Hello everyone, I'm Dr. Sujata Sharma. I'm a professor in the Department of Biophysics, All India Institute of Medical Sciences, New Delhi. I'm also an author of the book Warriors in White. Now, this book is an autobiographical account of my days in the COVID pandemic. It also contains 6 very powerful and inspiring stories about COVID warriors in AIIMS and other leading hospitals all over India. Now, the first warrior in white you're going to meet today, and that's Dr. Archana Sasi. She needs no introduction. She is a role model and a youth icon amongst all medical aspirants all over the country. That is because she topped the medical entrance exam in the years 2012 and 2017 at the undergraduate and postgraduate levels both. Why I have compared her with the planet Saturn is because she's the epitome of the planet of humility, of hard work and discipline. Over to Dr. Archana. So let me first ask you, Dr. Archana, you became a celebrity at a very young age. I think you were 18 years old when I think I heard your name even before you entered in. So how did you handle being, such a popular person suddenly, a household name?
I feel that the course of my life has taken me to this really grand institute in a way that I can't very well explain, but I feel that it is more of enjoyment during each course of it. Before the last few, whether it was the last few school years or the years during my MBBS or the years during my residency, they're all, I feel like I really enjoyed my time, and progressively the amount of, because medicine is not a subject that you learn or study, it is a subject that you experience. And I feel that as those experiences built up, my interest towards the subject grew gradually, and it was that more than anything else that really brought me here and in this book, of course. So, I mean, of course, there is a good amount of hard work that goes into it. There is a good amount of reading of books, but more than anything else, it's what you see, what you feel about. I mean, the subject and all that it brings to you.
So you feel that it was the love that you had for the subject
Yes,
that actually took you. So it's all about our emotions,
yes, ma'am.
right?
Definitely.
Right. So, Archana, I think this is the burning question, which I have read in Quora also. How does Shashi study? How does she, make notes? Everybody's so curious about this. So, would you like to give some tips to your fans, the ones who aspire to be like you?
Really, since MBBS here, what I felt was it's a very free journey. There is nothing that stops you, tells you you have to do this, you have to do that. At least I'm talking about what I experienced in the All India Institute of Medical Sciences. So here I felt like because there was no one telling you what to do, you feel like you have the freedom to experience everything, a touch of everything, and that allows you to grow more. When you're not doing something because you're forced to, but because you want to, I feel the results of that are different. So I think that I mean all the lectures we had here were really good, given to us by very experienced clinicians. The opportunities, the kind of patients that we see during our postings throughout MBBS, and the amount of learning that we get from them. It's all about how much we're willing to absorb from them, rather than how much you. So when you see all this and then you go back and you read about them, the whole studying experience is itself different, and the amount you gain from it is also different. So apart from that, there are, I mean, having keeping good notes, attending classes, being a little bit of being quite regular about things, it does make a difference, certainly. But I think it more than the need to be disciplined, it is the environment that this place gave me that allowed me to progress.
Yeah, one of your consultants told me that you attend every class and you're even there in many CGRs and CCRs. You don't leave any opportunity to learn. I think that's part of the preparation for success, right? Being regular.
Yes, definitely. I mean,
and showing interest.
So the institute gave me that atmosphere that I very much needed.
Which you very well responded to.
Yes.
I think institute gives everybody that environment, but it's how people respond to it that makes a difference, you know. So Archana, coming back to the book, I have compared you to the planet Saturn, as I said in the beginning of the interview, because you know you have these qualities of hard work, discipline, being regular, and of course you're very humble also. But what I have talked about in your chapter is in the initial parts of the pandemic, there was this fear in all the residents. They used to fear, what if we get infected ourselves? Because you know at that time there was very little knowledge, and there were a lot of myths floating around. And in our chapter, it's very inspiring to read about how a resident feels, how you felt that you may have got infected, and yet you did not budge from your duty. You kept standing there, you kept working hard, and you overcame it. So, would you like to tell me about those days?
Basically, to start with, I was not, at least in general, a very cautious person. Like initially, when in January, February, say, when everyone was going on about wearing masks and using sanitizers, I was a little bit skeptical, I would say. But then gradually, when we heard about first what was happening in Italy and what then started happening in the Americas, so there that fear started because of my parents who are there, who I stay with at home. So they're on the older side, and then what you bring home to them, I mean, that fear that you might be the one who brings something home to them which you will regret lifelong.
Right.
That is the only thing that I felt really instilled any kind of fear in me. Otherwise, the fear of infection would not have touched me at all. But because of this, I was very disciplined for what I would have expected from myself about wearing masks, about using gloves, about sanitizers, and everything. So I feel that was the thing I feared the most. And that fear, I can say, grew a little bit when I tended to COVID patients myself, the ones who were in frank ARDS, the ones who were not so very morbid per se before actually encountering COVID. So when you see that, you kind of think about what could happen to the normal average person who was a little above 40s, in their 50s, and faced with COVID, and then you feel responsible. But towards the end of the pandemic, gradually, as once an unknown entity became more of a known entity, once immunity developed in the population, once vaccination came about, now I can say that I'm a lot braver when it comes to COVID.
Okay. So, Archana, now I'm asking you to imagine something and be really honest about this answer. You know, you were caught in this pandemic being a resident. You were literally on the front line. And I know there are residents before and after who will not face, you know, what you have faced as a resident. Now, just imagine, like I have written in a chapter after talking to you, that there was a time when you were contemplating about which career should I take up. You had so many choices. And at that time, you decided, let me take up medicine. Had somebody told you that you're going to take up this career, but when you're going to just start your residency, there's going to be a global pandemic and you're going to be caught right in the middle of this, would you have still gone ahead with your decision?
I think that's quite a simple question for me.
Yeah.
I definitely would have gone through. There is actually nothing I would have changed.
Or would you have been more excited to go for it?
I mean, I wouldn't say excited, but I would say that I accepted it as it is because of the fact that I am a physician. So I have done my residency in the field of internal medicine. So here, a field which is where critical care plays such a huge role, even in our day-to-day patients. When it came to patient management, COVID was just another subset of patients who were faced with critical illness and its complications. So tending to such patients, I felt, was still as much a part of medicine as otherwise.
Right.
So except for the fear of actually contracting the illness, I don't really think that it would have made any change in my decision to pursue this or not to pursue what I actually.
And do you sometimes get frustrated that this pandemic is just not going? It's become a part of our lives now.
I feel in a way it is sort of that aspect of it has fizzled out. I mean, I'm not saying that it's not something we should worry about. It definitely is. We should, in the sense that we should take all precautions, but we shouldn't get
Hmm.
frustrated with it or
Right.
think about it in that much of a. It is not a barrier to anything. As ma'am has very aptly pointed out in the book,
Hmm.
it's not a barrier to anything. We can do anything we want to.
Hmm.
We should not use that as an excuse.
Okay, Archana. And tell me something. If you were to just look as an onlooker, you have seen your own journey. What is the difference between pre-COVID Dr. Archana and post-COVID Dr.
I guess the post-COVID Dr. Archana has a little more faith in humanity, in the way that humanity is able to come together,
Right.
in the way that countries, in the way that the nation, in
Hmm.
the way that different departments have been able to come together against a common foe.
Right.
I mean, it kind of makes you feel how, I mean, how significant something, how what it takes to bring everyone together in one place. And I mean, looking back and seeing the lessons that we all learned as a planet together, it's very, I mean,
Hmm.
it's a very interesting thing to look back upon, and I feel happy to have been a part of that introspection.
Right, right. So, Archana, actually, there were many COVID warriors who wanted to be part of this particular book. And I chose you because I saw something which I felt a reader would just pick this up and read a chapter and get inspired. I want to know your thoughts. How did you feel when I contacted you, when we set about this journey of putting your chapter together and this book came about? How did it change you?
I felt very honored. I mean, being part of a book, it's not something that you dream of. I mean, that you really think about. I mean, I had a grand time telling on my relatives and friends about it. I mean, it's still something to,
Though, of course, you are not a stranger to fame. You've
no,
already,
but this is
yeah,
definitely different from
yeah,
anything else. And it felt actually the thing is, when this pandemic came about, the way that we are projected to the general population, it's when they show doctors on television, they just show us as people wearing those white. So that's not something that the public can, relate to. That people can relate to. That it's not there. There are no emotions on the screen. There are just people wearing
right.
masks and white suits. This book actually shows each, the each doctor or each COVID warrior from the inside. And this is not a story just of these 6 COVID warriors, but of every COVID warrior, every doctor, every nurse, every supportive staff, and who's fighting this pandemic. So, I mean, there is a story behind everyone. That is what this book actually shows.
Thank you so much, Archana. Thank you for being part of this book, part of my journey during the COVID pandemic, and thank you for coming over here and giving us your thoughts. And I would say to everybody, do pick up this book. This is going to give you some really inspiring insights into wonderful Dr. Archana. Thank you very much.
Thank you all.